Hi guys, our next topic is Cushing syndrome. Cushing syndrome is due to the tumor producing ACTH and ACTH leading to high cortisol level. This Cushing syndrome can be due to any exogenous intake of ACTH, ectopic ACTH, pituitary adenoma or any adrenal pathology. These are the symptoms that you see in Cushing syndrome. To be very specific, abdominal stretch marks, abdominal weight gain, excessive hair growth, and buffalo hump, easy bruising, muscle loss. These are the very specific symptoms that you see and you diagnose Cushing syndrome. There is a proper algorithm of the test and the treatment. In the test, if you suspect Cushing, then you do overnight dexamethasone suppression test. The tablet is given at 11 p.m. Then next morning at 8 a.m. cortisol is measured. If it is less than 2, then it is that means the level is decreased, the cortisol level is decreased, and if it is still more than 5, then Cushing is confirmed. Next we do we do test for ACTH. If the ACTH is increased, that means there can be two things: either pituitary adenoma is present or ectopic ACTH syndrome is there. Then you do another suppression test, but it is high dose DEXA suppression test. In this 2 mg 6 hourly for 48 hours, the dexamethasone tablet is given. Then we measure the cortisol level. If it is decreased, that means there is a problem in pituitary, that is pituitary adenoma. If it is still increased, then there is the case of ectopic ACTH. If it is equivocal, then we do image guided sample removal from inferior petrosal sinus and we check ACTH. Along with it, we draw blood from periphery and then we check the ACTH. If we take the ratio and petrous is to peripheral ratio is more than 2:1, then it is pituitary adenoma. But to be doubly sure, we inject the injection of CRH and then we measure petrous is to peripheral level. If it is more than 3:1, then sure it's pituitary adenoma. Okay. If in the starting ACTH is decreased, then we do NCCT adrenal gland. Okay. If it is bilaterally enlarged, then it is the case of adrenal hyperplasia. If it is unilaterally enlarged, then it is the case of adenoma. If on measuring it is less than 6 centimeter, it is benign. If it is more than 6 centimeter, it is malignant. On 17 keto steroids given, it is decreased in benign and increased in malignant. Then what is the treatment? Basically, the treatment is to inhibit cortisol synthesis, inhibit ACTH secretion, and inhibit cortisol action. So these are the drugs which are used for cortisol synthesis inhibition. The cabergoline is used for ACTH secretion inhibition, and mifepristone is given for cortisol action inhibition.